Imagine you're walking down the street. The world looks the same, but for one tiny detail, above every single person, including yourself, floats a simple bar, a health bar. Bright green and full for that jogger breezing past you. A little lower, maybe a concerning yellow for the man coughing on the park bench. It updates in real time with every choice they make. Every sip of soda, every deep breath of fresh air, every stressful meeting, a constant, visible stream of data on their well-being. It sounds like the ultimate life hack, a way to finally understand our bodies and each other. But this simple visual change would not just change our lives, it would fundamentally break and remake our entire reality in ways you cannot even begin to imagine. So, how would this even work? This isn't magic, it's data. Our bodies are already producing a torrent of information. Your smartwatch tracks your heart rate, your phone counts your steps. Now, imagine a system, maybe a bio-integrated chip or advanced non-invasive scanners that consolidates everything. We're talking real-time analysis of blood pressure, cortisol levels for stress, blood glucose, immune system response, even cellular regeneration rates. This system would then process this complex data into one simple, universally understood metric, a health bar, from 100% to 0%, the ultimate user interface for the human body. The initial impact? Nothing short of revolutionary. Think about medicine. Emergency rooms would be transformed. A paramedic arrives at a chaotic scene and instantly knows who is in the most critical danger, their bar flashing a desperate red. Doctors could diagnose illnesses with breathtaking speed, seeing a slow, steady decline in a patient's health bar long before physical symptoms ever appear. It's preventative medicine on a scale we can only dream of. A dip in your bar after eating a certain food. Instant feedback on a potential allergy. Your bar regenerating faster when you get 8 hours of sleep. The motivation you need to ditch the late-night doom scrolling. And it wouldn't just be about avoiding sickness, it would be about optimizing wellness. Fitness goals would no longer be abstract. You could literally see the bar extend and strengthen after a good workout. Diets wouldn't be guesswork. They'd be a clear cause and effect relationship playing out above your head. We'd have a society of people perfectly in tune with their physical selves, a world with less chronic disease, longer lifespans, and a shared visible goal of well-being. But then, the novelty would wear off, and human nature would kick in. What happens when this deeply personal data is no longer personal? What happens when you walk into a job interview? You've got the perfect resume, you've nailed every question. But the interviewer's eyes keep flicking up above your head. They see your bar is at a respectable but not perfect 82%. Maybe you have a genetic predisposition to a certain condition. Maybe you're just having a stressful week. It doesn't matter. Next to you is a candidate with a shimmering 97%. Who gets the job? The company wants productive, reliable employees. A lower health bar could become the ultimate unsaid disqualifier. Our entire social fabric would be rewoven. Dating apps would surely integrate it. Forget swiping based on hobbies. Now you can filter by health. Seeking a long-term partner with a health bar of 90% or higher. It sounds cold, but isn't it logical? We'd want our partners, our friends, the people we rely on to be healthy. This would create a new, brutal form of classism. The vitals and the fades. The rich, who can afford organic food, personal trainers, and stress-free lifestyles, would walk around with glowing green bars, a visible symbol of their status. Meanwhile, those working two jobs, living in polluted areas and struggling to make ends meet, would see their bars permanently stuck in the yellow or orange. Their health status, a direct result of their socioeconomic condition, would now be a public label, a brand. Could you get a bank loan with a 60% health bar? Would an insurance company even cover you? It creates a terrifying feedback loop. Poor health leads to fewer opportunities, which in turn leads to even poorer health. And what about our own minds? Imagine the anxiety, the constant, unending pressure of maintaining your bar. Every meal becomes a calculation. Every stressful day at work is visualized as a tangible loss. You'd see your bar dip and panic. Are you sick? Is it something serious? This isn't like a notification you can swipe away. It's there, always. We would become a society of obsessive self-scanners, a world of hypochondriacs. And what about those with chronic illnesses or disabilities? Their bars might never be full. How would society treat them? With compassion, or as a drain on the system? How would they feel, forced to wear a constant public reminder of their condition? True strength, the resilience it takes to live with a chronic condition, would be invisible. All people would see is a number, a deficit. This brings us to the core of it all. Seeing a health bar above everyone's head wouldn't just show us their physical state, it would fundamentally change our definition of human value. We say that a person is more than their physical body. We say that character, kindness, intelligence, and spirit are what truly matter. But in a world with health bars, would we still believe that? Or would we be seduced by the simplicity of the number? The bar can't measure courage, it can't measure love, it can't measure the quiet strength of someone battling a disease, or the wisdom gained from a long and difficult life. It can't show the health of a person's soul. So, what if we could see a health bar above everyone's head? We might gain a world free of many illnesses, but we would risk losing something far more important. Our ability to see each other for who we truly are, in all our imperfect, unquantifiable, and messy glory. Maybe some things are better left unseen, not because they are scary, but because seeing them prevents us from seeing everything else.